Good afternoon, everyone. Our apologies for the delay. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Deena Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. I echo Tom's apologies for the delay in providing today's update. We have encountered a technical issue in the reporting system, so unfortunately I will not be able to provide detailed case numbers today. This has not impacted our ability to identify and follow up on new cases. It has only impacted our reporting system with our dashboard. The team is working hard to address the issue as we speak. I have committed to give Albertans the most transparent and accurate information available at any given time. As part of our usual quality assurance process, the team discovered some internal discrepancies that I felt needed to be addressed so that I could feel comfortable we were presenting data that was as accurate as possible. Tomorrow, we will provide a detailed update for both days. While I don't have detailed case numbers today, I can tell you that about 800 new cases have been identified in the last 24 hours. Currently, 9 hospitals across the province have outbreaks, including a new outbreak declared yesterday at the Chinook Regional Hospital. AHS is working hard to limit the spread and safely manage all outbreaks to protect residents and staff. It is important to remember that hospitals are still safe. If you need urgent care, do not hesitate to seek it. That said, I am very concerned about the level of hospitalizations for COVID in Edmonton and Calgary. We must protect our health system by reducing community transmission. The fact that we are now reporting 800 new cases is extremely concerning. It is most concerning because it means that the measures that we introduced 10 days ago, which may have helped cases plateau over the last few days, are not having enough of an effect. It means that in about 7 to 10 days from now, our hospital numbers will rise further, which means that care for Albertans with other issues besides COVID will be impacted. One significant concern I have is around the high proportion of active cases being identified who attended work or social events while symptomatic. I do have numbers for current cases up to yesterday, and they are concerning. In Edmonton, 9% of active cases worked while they had symptoms. A further 8% visited retail or service businesses, and 8% attended a social gathering. The data is similar for Calgary, where 11% worked while symptomatic and 9% traveled. Further, 7% attended a social gathering. With more than 2,500 active cases in each city as of yesterday, we are talking about at least 500 people who did not stay home while symptomatic. This is significant. I am calling on Albertans to please stop all activities if you have any symptoms. By leaving your home for any reason other than getting tested or seeking health care, you are putting others at risk and potentially spreading the virus so that one case can lead to many. I know that it is inconvenient and disappointing, and I know that it can create tough choices for some. But it is essential, and I also repeat my request that employers recognize this importance and support their staff to do this wherever possible. It has now been 10 days since we announced new public health measures in Calgary and Edmonton, including the mandatory 15-person limit on social gatherings. I have had many people ask me why we're focusing on social gatherings. The answer is because it is a problem that is driving COVID spread in our communities. By far, the #1 driver of new cases we are seeing is exposure in households and private gatherings. Currently, about 40% of the active cases in Calgary and Edmonton as of yesterday were exposed either in their household or at a private gathering. If we could reduce cases in this area alone, then we would be quickly able to bend the curve back down. The other big area that is concerning is that many of our cases have unknown exposures. In some cases, this is just because the public health investigation has not yet been completed, but in others, there is truly no known source. This is another problem that can only be solved if we work together. By reducing the wait times for booking a test, shortening the wait for test results, and hiring more contact tracers, we will shorten the gap between when a person is exposed and when a contact tracer is able to talk to cases, identify their close contacts, and break the chain of transmission. The shorter this gap is, the easier it becomes to identify exposure sources and reduce the spread of COVID. Unfortunately, as cases have risen rapidly, we are experiencing challenges in our contact tracing teams. AHS does not currently have the capacity to call every contact of every case in a timely way. Effective today, as an interim measure until more contact tracers can be hired and trained, AHS will be focusing their contact tracing on high priority settings only. Every confirmed case will still get a phone call from AHS to identify whether or not they have a link to a high priority setting, like a continuing care facility, a healthcare setting, or a school. If a case attended a group event, like a wedding, a party, or a group fitness class while infectious, or if this could have been the source of their infection, the organizer of these events will still be contacted to ensure attendees are notified. But if cases are not linked to a high priority setting, the case will be provided with information and asked to notify their own contacts of exposures and the need for them to self-isolate and get tested. Resources and information will be made available to these individuals to help them do this. I ask anyone who is notified that they are a close contact, whether by AHS or directly by someone you know, please be compassionate. You are being notified for your own protection and the protection of those around you. Please self-isolate immediately and get tested if you are identified as a close contact. I have said there is no single right way to navigate this pandemic. This remains true, and we must be mindful of protecting each other from the impacts of COVID and the impacts of restrictions. At the same time, I have said that this is a critical juncture. We need to change the trend in this province. While Calgary and Edmonton have the highest active case numbers, we have seen a concerning rise in numbers outside these two cities as well. We now have 46 municipalities on watch, with more than 50 active cases per 100,000. And even more concerningly, 29 of these have more than 100 active cases per 100,000. Our numbers today show a large increase, not the plateau we had seen for the past few days. We should be starting to see the impact of the measures we put in place last week. And as I said on Tuesday, a plateau is not enough. An increase is even more concerning. Our health system cannot care for the increasing volume of COVID cases without stopping other services, which is happening now. Unless our numbers decline dramatically in the next few days, we will have to consider additional measures to bring COVID numbers down in order to protect our health system. We also need to protect those most at risk for severe outcomes. This week, I communicated with continuing care operators in Edmonton and Calgary, recommending that they consider limiting visitors to only the essential designated family or support people and others in extenuating circumstances, while the transmission rates are high in these cities. In the rest of the province, I have advised operators to consider the transmission in the area where visitors are coming from and ensure that all necessary precautions are in place to limit the spread of COVID-19. We are looking closely at all the areas where spread is occurring in Alberta, and we are looking at measures to help slow transmission. In the meantime, I want to stress that social gatherings, while a key part of human connection and a source of joy in our lives, are a problem when it comes to COVID. It will never be possible or appropriate to regulate every facet of people's lives. What we need is Albertans to work with us, to take actions in their own lives to make a difference. Until we start to see case growth diminish, we need all Albertans to think carefully about any social or family gatherings that they attend or host. Postpone events if you can. If you can't, please keep them as small as possible and as safe as possible. Safe gatherings means if you are sick, stay home or cancel the event if you are hosting. It also means staying seated and distanced, wearing masks, meeting outdoors if possible, and avoiding sharing food or serving utensils. If it is possible to meet people outside your cohorts virtually or over the phone, please consider this whenever feasible. I know it is frustrating, but with COVID-19, our actions do not show immediate results. This weekend, if we don't have a birthday party, if we stay home from a family dinner because we're not feeling well, if we wear a mask to the grocery store, we will not yet see the results in Monday's numbers. But if we lead by example and follow all public health measures to the best of our ability and respectfully help others who do not understand the measures or their importance, we can see results in the next 2 weeks. I believe in Albertans and our ability to come together. We are looking closely at what steps we need to recommend to government to protect the health of Albertans. But we need your help as well. Please be wise, be vigilant, and keep your social gatherings as small and safe as possible. Thank you, and I'm happy to answer any questions you may have.
All right, we'll go to the phone now. Operator, could you put through the first caller, please?
Thank you. Yes, the first question is from Don Braid, Calgary Herald.
Dr. Hinshaw, an alarming number for sure. Do you have any evidence that Halloween was any part of this? It's been, 5 days? It's possible some of this may have started. And this has been a very unusual day with not seeing any other numbers, and I'm just wondering how you're feeling personally about the urgency of this situation. It's felt a little strange to a lot of us who watch this all day long. So could you tell us about Halloween and how you feel about where this has gotten to?
Absolutely, and I'll tell you that one of my big concerns is actually that I don't think that Halloween is yet driving these numbers, because we know that most cases that occur after an exposure happen between about 5 and 8 days after that exposure. And if we consider that people might get sick and then it takes perhaps a day for them to get tested and then about a day for them to get results, these numbers that we're seeing now coming out of the lab probably aren't the biggest increase that we potentially could see from Halloween. So I am very concerned that we could see potentially higher numbers in the days ahead if those Halloween gatherings that we were strongly encouraging not to happen went ahead, and if there were infectious people there. So we will be very, very closely watching the numbers in the days to come. With respect to the strangeness of not having the data, certainly I am used to having the data, of course, at my fingertips, and this has been an odd day for me as well, because as I said, early on we identified an internal discrepancy, and so have been working with the team, and I have an amazing team who's been working all day to try to find the source of the issue and then to fix it. So what I would say is that I am confident in, again, this number that we do have about 800 cases, and that we will work to make sure that we have accurate information on all of the other parameters available tomorrow. But I am concerned. I'm concerned about this trend. It certainly does not match with what we had sincerely hoped would happen with the plateau over the last few days, and we will be watching very closely.
Operator, could you put through the next question, please?
Jesse Wisner, Global TV.
Hi, Dr. Hinshaw. With the large spike in new cases, when will we see more restrictions and specific measures if the numbers don't go down? And at what point do we go back into lockdown?
The timing of restrictions really depends on decision making. So we are having discussions about what measures would be appropriate given this concerning number of new cases in a single day. And depending on the outcomes of those discussions, again, the timing of when we might see new measures it really depends on how these discussions go over the next few days. The question about whether or not we would go back into lockdown, again, the answer is that it lies, as it always has, in our hands as Albertans and the everyday measures that we take. And I know that the measures are not easy, and I know that we are all tired. However, the question about how many restrictions need to be put in place is entirely up to us. If we're able to bend this curve collectively with fewer restrictions, we will not need to go into anything like what we had in the spring. But of course, we need to be able to bend this curve down so our healthcare system is not overwhelmed. And so we will be considering measures appropriate to where our transmission is and to where our numbers are.
Operator, could you put through the next question, please?
James Keller, Globe and Mail.
Hi there, Dr. Hinshaw. I'm wondering why we're not talking about those new restrictions today. I mean, we've seen for months and weeks this reliance on, personal responsibility and voluntary guidelines. It seems what you're describing that those aren't working. So why are we, as of today, still continuing on that road and not instead looking at other options?
What we saw when we put the measures in place, first of all, the measures that were put in place in in Edmonton and surrounding area in early October, and then 10 days ago, the additional measures in Edmonton plus the measures in Calgary, we did see an impact with respect to slowing the growth rate. And again, we want to make sure that Albertans have every opportunity to work with minimal restrictions before putting in place additional ones. Clearly, again, with the numbers that we're seeing today, we have not had the effect that we need to have. And again, the question of timing really is about wanting to be sure that the measures that we're putting in place are balancing, again, the COVID impacts and the impacts of restrictions. But again, clearly we do have concerning trends, and we are needing to consider recommendations for new measures that the government can consider.
Operator, could you put through the next question, please?
Tom Ralston, Global News.
Hi, Dr. Hinshaw. Thanks for taking my question. In the Lethbridge area, we, like much of the province, continue to see a steady stream of new cases and outbreaks. Just today, we learned of an outbreak at the hospital here. We've also learned a junior hockey team in nearby Coaldale is isolating. You said a couple of weeks ago the majority of cases here are coming from a known source. Is that still the case, or has the dynamic in this region changed?
I did ask my team to look into not just Lethbridge, but looking into other larger centres because we are seeing some increasing cases, not just in Lethbridge, but in other areas across the province. Unfortunately, because the team has been very focused on some of the data issues today, I don't have that breakdown. I know I have been speaking to my local medical officer of health colleague in Lethbridge to make sure that if there's any additional supports that are needed, that she knows she has my full backing. And to date, again, the local public health teams have indicated to me that they feel that the measures that they have in place working with the city are adequate. So certainly when we do have our data back up, that is one of the things that I'm interested in knowing is whether that's still the case, whether Lethbridge still does have the majority of cases coming from known sources and the ability to stop transmission. But again, unfortunately, I don't have that information at my fingertips today.
Operator, could you put through the next caller, please?
Anna Juncker, Edmonton Journal.
Hi, Dr. Hinshaw. The last few days where we did receive numbers, the number of tests have dropped. Yesterday there was just over 7,400. So I was wondering why, or if you know why, the testing numbers have been so low.
The testing numbers that were released yesterday, unfortunately, some of the data issues we've been seeing over the last 2 days, the data delay that we had yesterday resulted in the case count being accurate, but unfortunately there was a discrepancy between the total number of tests and the number that was reflected in yesterday's numbers. So it was actually about 11,000 tests that were done yesterday. Today the numbers are about 14,000. So the numbers, I think there was a bit of a drop around Sunday or Monday, but the numbers other than 1 or 2 days have been above 10 or 11,000 as they have been for a while. So again, yesterday's number was unfortunately a discrepancy that will be corrected when we post the updated numbers tomorrow.
Operator, could you put through the next caller, please?
Jason Herring, Post Media.
Good afternoon, Dr. Hinshaw. I do understand that there have been data issues and database maintenance, but I mean, despite this surge in cases, we haven't had data on weekends for months. We didn't get any data this Monday. We got some yesterday, hours late, and we're only getting the bare minimum today. I'm just wondering how the province can justify this.
This has not been a good week, and unfortunately, as you say, there have been a few different things that are completely unrelated that unfortunately have come together in the same week. So the system upgrade that happened on the weekend was a completely different system than the one that's currently causing us issues that caused the late reporting yesterday and the challenges today. And in terms of the justification, again, all I can say is that our data teams have been working incredibly hard. They've been starting work early, working late. They've been working like this for many months. And unfortunately, we have had these two major data issues in the same week. And all I can say is that the reason that we are not releasing numbers that we're not confident in is because we want to make sure that Albertans have the benefit of as accurate information as we have. And while I know that it's frustrating to not have that detailed information today, it has taken the full day to try to understand all of the different challenges that contributed to this discrepancy in numbers, and it will take many hours yet to be able to fix that and to run the updated reports. So I apologize. I am sorry. I know that Albertans rely on this data, as do I. This is not anything that our teams have done wrong. This is something that happens just like a car occasionally breaks down. Sometimes our data systems have hiccups and we need to investigate and then fix them. And again, as I say, our teams are feeling confident that tomorrow they will have these glitches fixed and updated, and we will have accurate data tomorrow.
Operator, could you put through the next caller, please?
Shannon Scott, CBC.
Oh, hi, Dr. Hinshaw. I'm just wondering about the decision-making process around putting in possible restrictions. You've often talked about the percentage of cases that come from things like restaurants and today social gatherings and at home. So I'm wondering, when you add up all those percentages, eventually we're talking about a whole lot of numbers. So what goes into looking at those numbers and deciding how to best put in a restriction and what restriction might work best?
When we're considering what measures to put in place, we, of course, look at our current numbers, our active cases, and look at what patterns we can see where we know the transmission source. One of the things that we consider is the fact that particular types of transmission, such as social gatherings, can be events where people from many different networks come together. And so transmission at a social gathering can have a bigger impact overall than, for example, transmission within a household. So if, for example, you have an individual who attends a party, they may be feeling well and not know that they're incubating, and they may be infectious. And maybe they pass to 8 other people at that party, but each of those 8 then goes off into a different workplace, into a different household, and that transmission from that single party can have a very large impact on the surrounding community. So when we're looking at the places where we want to limit the spread, we're looking again at where most of the spread is happening. We're looking at where we know restrictions are effective. And again, we know that reducing gathering sizes is something that can have a significant impact. When we're looking at other places where transmission happens, we're looking whether or not there are measures that can be put in place to mitigate that. So again, as I've mentioned, there's less than 1% of our active cases that have a link to a restaurant, and we know that many restaurants have put many mitigation factors in place to prevent transmission in those locations. And again, trying to figure out where do those measures for public health reasons, where are they going to have the most impact? And that's how we prioritize which measures we bring forward.
Operator, could you put through the next caller, please?
Alex McQuaig, Chat News Today.
Hi, Dr. Hinshaw. My question is along the same lines of what you've been addressing so far. We had an event here in Medicine Hat over last weekend that resulted in multiple people being put in quarantine, getting tested. Yet AHS isn't even confirming this event occurred. I guess our question is how is the public interest served in those situations if these social gatherings that potentially have such a wide impact aren't being confirmed by AHS?
I don't have the details of the specific event that you're referencing, but our current policy that we've worked on with Alberta Health Services is if there is an exposure at a particular event, so a party or a social event, AHS works with the organizer to make sure that everyone who was present is notified. I will note that because of the significantly increased volume of cases, new cases over the past week to 10 days, that Alberta Health Services has been unfortunately experiencing delays in their ability to have contact tracers reach out to individuals. So whether or not that may be a factor in the case that you're referencing, I don't know. But that is one of the reasons that they are making this change effective today, to focus on those higher priority settings, to focus on gatherings, to try to get people notified as quickly as possible. And then with respect to public reporting, if there is a location where there's been widespread exposure and we don't have a list of all the people who were there, in that case we would certainly consider publicly posting an event or a location if we felt that there was risk to the public for those who had been there. If that's not the case, then we don't necessarily make that information public if we are able to contact directly all the people who attended an event. But we do have a process by which we have outbreaks listed publicly on Tuesdays and Fridays. We update the outbreak list on our website. If it is a private event, we do not identify an address or a name because of patient confidentiality issues. However, we do indicate private gatherings just so people can understand where our outbreaks are coming from if they reach a certain level of cases. So again, you have to have, with respect to outbreaks, usually it's about 10 cases, private gatherings. I'm not sure what the number is right now. We've been working to make sure that we are disclosing these events appropriately, but that we're not inappropriately discouraging people from coming forward and getting tested if they feel they're going to be shamed by being posted publicly. So that's a balance that we're striving to keep.
All right, we've got time for 3 more questions. Operator, could you put through the next one, please?
Julia Wong, Global News.
Hi, Dr. Hinshaw. Social gatherings have been touted as one of the primary sources of spread, but our rules for gathering and cohorting are still pretty liberal. Other jurisdictions have moved to smaller gathering sizes than 15, and Edmontonians and Calgarians can still have 3 cohorts. Will Alberta move to smaller gatherings and fewer cohorts per person? And also, contact tracing has been also touted as a pillar in this province to try and get this virus under control. Are there concerns that contact tracing is going to break down completely if individuals who aren't at events or in those high priority settings are responsible now for contacting their own close contacts?
We are looking at multiple options for measures, and so whether or not those numbers change or whether other measures are put in place, again, hasn't been decided. When we look, for example, at BC's measures where they say you can't have more than 6 people outside your household over to your house for a gathering, and our limit for a social gathering is 15 people total. Again, that could be actually a relatively similar number depending on how many people live in your household. And so rather than having that depend on household size, we've again limited to that maximum number of 15. But of course, what we encourage all Albertans to do, especially right now, is to think about the number of people they're in close contact with every day, make that as small as possible. And the number of different networks that intersect, make that as small as possible. And these rules that we have are guidelines, but Albertans can certainly go above and beyond. With respect to the contact tracing piece, of course, we are working with AHS to support them to hire and train contact tracers as quickly as possible. And this is a temporary measure for the time period where we do not have enough resources to call every single contact. However, the importance of making sure that cases notify their own contacts will be stressed to them when they have that phone call from the Alberta Health Services public health professional, and resources will be made available to them to make those notifications. And we really are relying on Albertans to partner with us at this time to bring our numbers down.
Operator, could you put through the next caller, please?
Yes, Lauren Pullen, Global Calgary.
Hi, Dr. Hinshaw. With seeing community case numbers so high, we obviously want to have a focus on our hospitals being able to do everything that they can to help those patients at this time. And as you mentioned, most of our major hospitals throughout Alberta do have outbreaks going on right now. I did speak with a doctor who has said there is a failure in the system that is allowing COVID outbreaks to spread within hospitals, that there hasn't been any policy change since COVID-19 started. We still don't know how it's being transmitted within the hospital, ward to ward, or to those healthcare workers. Are there any new policies being looked at, or what will be implemented in hospitals to try and mitigate this? And when can healthcare officials or even management receive details of the Misericordia outbreak to possibly look at policy changes? Is there a timeline?
We're working with Alberta Health Services on the Misericordia outbreak report and other outbreak reports. I don't have a timeline at this point, but what I do know is that there have been policy changes following some of the significant outbreaks that have happened in acute care. And some of those include things like how patients with dementia are supported, making sure that individuals with dementia, where we've seen that that can be a significant source of spread if they are wandering or if they're not supported to be able to stay in one place. And so that's one change that's been made. We've seen, for example, multi-bed rooms as a significant challenge where you have multiple patients in the same room. And Alberta Health Services is working very hard to limit the number of multi-bed rooms that are used to full capacity because of that challenge. And so there are certain specific things that are being done. However, I understand that people do want to see a list of those, and we will continue working with Alberta Health Services to get that made available as soon as possible.
Operator, could you put through the final question, please?
Thank you. Yes, the final question is from Carrie Tate, Globe and Mail.
Hi, Dr. Hinshaw. When you introduced the voluntary guidelines in Edmonton, you had said it was to give people a chance to basically turn this car around. And then when that didn't work, you introduced the 15 social gathering cap in Edmonton and Calgary, and that hasn't worked. I'm wondering if you have made recommendations to government that have been rejected.
We are in discussions right now with respect to measures given our current trends and again, the importance of making sure that we are balancing the harms of COVID and the harms of restrictions has been present in all of our discussions. Given, of course, the fact that our current numbers are indicating that the measures that we've put in place to date have not been as successful as they need to be, we are having additional discussions about what other measures we need to be looking at.
Thank you all for joining us. As Dr. Hinshaw mentioned, tomorrow we will provide detailed update online of today's case data as well as tomorrow's. Have a good night.